Chapter 9, Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 1. Listen to dialogue number 1. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple choice questions at the end of the dialogue.
Good morning. I'm Richard Mendez, and I'm the pharmacist working with your doctor, Dr. Gabby Lucas. Are you Ariana Snow?
Yes.
How are you today?
I'm okay. Can I go home now?
Well, you are being discharged from the hospital today, but first I need to go over your new medication with you and your mom. Are you Mrs. Snow?
Yes, I am.
It's very nice to meet you both. Like I said, I just want to review the new medication and answer any questions you have. I see from your chart that you have been diagnosed with epilepsy after having 2 seizures, and that this is the first time you'll be taking medication to control your seizures.
Yeah.
Out of nowhere, she had a terrible seizure. We didn't know what was wrong, so we raced her to the emergency room, and she was admitted overnight.
Did you lose consciousness, Ariana?
Yeah, I guess so. I don't remember any of it, but my mom told me that my legs and arms were jerking out of control and that my body got real stiff.
Well, hopefully your new medication will leave you free of seizures, or at least control your seizures. Dr. Lucas has prescribed Tegretol. That's the brand name. It's also known as carbamazepine. That's the generic name. This is what the Tegretol looks like. It's a red speckled pink chewable tablet. How old are you, Ariana?
I'm 16.
Tegretol is known as an anti-epileptic drug and an anticonvulsant drug that helps to treat your type of seizures, which are called grand mal seizures.
Yes, that's what the doctor said. How often does she take it?
Dr. Lucas has prescribed that you take 1 tablet twice daily. Ariana, take the pill with or without food, and make sure you take it the same time each day. But you shouldn't have grapefruit or grapefruit juice with this medication, unless your doctor says it's okay.
Ariana has always been very healthy. When she was younger, she used to get a lot of ear infections, and she was allergic to C-chlor, the antibiotic, to stop the infection. It made her body break out in a rash, and she'd get very watery diarrhea.
Well, it could cause unsteadiness as she adjusts to the medicine. Keep your eye out for nausea, dizziness, and vomiting. And it's not uncommon to feel fatigued. I'll give you a complete list of possible side effects, including serious but rare side effects.
What kind of serious side effects?
Well, though unlikely, pay attention to your chest and ankles. For example, if you get chest pains or if your ankles swell up, call your doctor immediately. And if you notice problems with speech or coordination, call your doctor. Ariana, do you have any other allergies?
I'm allergic to cats and latex.
Mom, does Ariana have any other medical conditions?
No, just ear infections in the past. She hasn't had one since she was 5. She did develop an eye infection when she first got her contacts, but she's fine now. And she's had stitches 3 times.
Yeah, on my head. I got hit with a hockey stick. I got 6 stitches. I also got 5 stitches on my chin. I got hit with a tennis racket. And I broke my right arm when I was 12 on a water slide.
Wow. Are you playing any sports now?
Yeah, I play softball. I'm a pitcher. I can still play even though I have epilepsy, right?
Talk to Dr. Lucas, but I'm sure you can continue to be physically active and participate in sports, as long as you take your medication and follow up with your doctor. But Dr. Lucas might want to talk to you about wearing a helmet when you participate in certain sports or recreational activities with a high risk of head injury. Also, it's very important that you wear a medical alert bracelet and don't swim alone.
What should we do when she has another seizure?
Well, roll Ariana to one side and put a soft pillow under her head. And don't put your fingers in her mouth. She will not swallow her tongue. And don't try to restrain her or yell or shake her when she's having a seizure.
Am I going to have seizures forever?
Well, everyone is different. But the good news is that most people with epilepsy do become seizure-free as long as they take medication. And we know that more than half of children with epilepsy eventually stop taking their medication and become seizure-free. And if you feel that Tegretol is not working for you, call your doctor.
Good. I can still play sports.
That's right, as long as you take your medication as prescribed. And never stop taking your medication unless directed by your doctor. Any other questions?
Nope.
Mom?
No, not right now. You've been very helpful. Ariana's tough as nails. She'll be fine.
Chapter 9. Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 2. Listen to dialogue number 2. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple-choice questions at the end of the dialogue.
Hi, are you Susan Wilson?
Yes, I am.
How are you today? My name is Lucas Page, and I'm the pharmacist on duty in the clinic today. I'm here to talk to you about the medication Dr. Lena Kasparova has prescribed. She has prescribed beta-sarin. Do you know why you need to take beta-sarin?
Well, I've been diagnosed with MS. Dr. Kasparova said I have relapsing multiple sclerosis and that I'm in the early stages of MS.
That's right. Beta-sarin will not cure your MS, but it will help to reduce the number of flare-ups and the attacks that make you weak. The medication will slow down the disease.
My doctor said that it's interferon.
Yes, it's the same as interferon, which is a protein that your body produces naturally. This protein helps the body's immune system. If you have MS, adding more interferon may help your body to fight the effects of MS. Did your doctor tell you that you need to inject the interferon?
Yes.
Okay. Now, before we go on, I just need to ask you a few questions. Is your birth date May 21, 1964? And are you 44?
Yes.
Your chart states that you're allergic to penicillin and wasps. Anything else?
No, I don't think so.
Do you think you might be pregnant?
No, I'm not pregnant.
I also see that you have a history of migraine headaches. Can you tell me more about that?
Well, I don't get them anymore like I used to. The last time I was on medication was 10 years ago. I think it was a beta blocker. Now, I know how to manage them. I know when it's coming. I get nauseous and I'm sensitive to light and noise. I just go to bed in the dark and put an ice pack on my neck and on my forehead until it passes.
Are you currently working?
Yeah, I'm a freelance writer, so I work from home most of the time. I make my own schedule. And since I don't have any children yet, I have great flexibility.
That's good. Okay, now back to beta-sarin. I will show you how to use it. You're going to inject this medication under your skin.
What part of my body should I inject?
You can inject the dose on your abdomen, your buttocks, your upper arms, or your thighs. It's a good idea to change the site of each injection to avoid any skin problems in that one area. And don't inject in the area where skin is infected, sore, or irritated.
How often do I inject?
You're going to do this every other day. It's better if you do this at night before you go to bed. This will help to reduce the side effects.
What are the side effects? Is this going to make me feel worse?
Well, it's not uncommon for patients to feel like they're getting the flu. It's possible to get a headache, feel tired, get a fever and chills, and have achy muscles the first time you inject the medication. You'll start feeling like this about a day after, but these symptoms will improve and eventually go away the more you use the medication. To help reduce these symptoms, also take Tylenol or Motrin before each dose.
It doesn't sound like much fun. Any other side effects I should worry about?
Well, it's not unusual to feel pain and swelling in the injection area. You might experience some abdominal pain, constipation, and diarrhea. But if you find that you're either too cold or too hot or really tired or see a change in weight, tell your doctor. And if you get a skin rash, itching, swelling, or have problems breathing, get medical help immediately. I'll give you a complete pamphlet with more detailed side effects and what you need to know about the medication.
There's more? What else do I need to know?
Well, if you miss a dose, try to take it as soon as you remember and call your doctor to establish a new schedule. Do not double up the dose to catch up, and do not inject yourself 2 days in a row. And make sure not to shake the vial. If you can see particles in the liquid, or if it looks discolored, don't use it. Let us or your retail pharmacist know.
Wow. I'll try to remember all of that. It's no fun having MS.
Well, it's important to take care of yourself. Make sure you get plenty of sleep, and don't stop exercising if you're already doing so. And swimming is also good for MS patients who are bothered by heat.
Yeah, I don't like hot showers or baths.
Some patients who are bothered by warmth and heat usually have their air conditioning on year-round, and it's very important to do the normal activities that you do and to continue to do the things that you like to do. And it's a good idea to join a support group. We have an MS support group in the hospital. Here, I'll give you the name and phone number of the nurse who runs the support group. Give her a call when you're ready.
Thanks, I will.
Chapter 9, Post-Assessment. Dialogue number 1.
Good morning. Are you Mr. Joseph Caruso?
Yes, I am. Are you the pharmacist? My doctor told me I need to see the pharmacist in the clinic.
Yes, I'm your pharmacist. My name is Andrea Thompson. How are you today?
Okay, but I'm a little bit shaky these days. I tremble a bit and my muscles get stiff. Sometimes I move normal and sometimes I get stiff. I had some tests and my doctor tells me I have Parkinson's. That's why I'm here, to get my prescription for the new medicine.
I have your patient chart here. This morning, I'm going to review your chart with you to make sure that I understand everything clearly. I'll review your medical history, your medications, and then explain to you the new medication you will be taking to treat your Parkinson's. Are you here alone?
No, my wife is parking the car. She'll be in soon.
Okay. Mr. Caruso, your first name is Joseph?
Yes, Joseph Anthony.
Your date of birth is January 23rd, 1945?
Yes, I'm 63.
I see that you have had high cholesterol. Are you still taking medication?
Well, I had high cholesterol. It used to be as high as 268 2 years ago. But my doctor, Dr. Elias Soto, told me I needed to lower it and lose weight. So he gave me Lipitor, and I was walking almost every day, and in 8 weeks I lost 12 pounds, and my cholesterol was 168. I used to weigh 225, and now I weigh 190. I'm not taking Lipitor anymore, but now that I started getting shaking and trembling, I walk less.
I am very impressed with your new cholesterol number, and losing 12 pounds in 8 weeks is really amazing. I hope you're eating well. Keep it up.
Yes, I think I'm eating well. I eat reduced fat or fat-free food, but I still like my pasta and my glass of red wine with dinner.
I also see that you have a history of constipation. What do you take for your constipation?
Well, I'm not constipated right now, but when I do get constipation, I take glycerin suppositories. I forget the name.
According to your chart, you have been prescribed Sanisup.
Yeah, that's the name. And I also take Citracel. It helps.
I also see from your chart that at one time your blood sugar was a little elevated.
Yeah, I had a blood test during my annual physical 2 years ago for my cholesterol, and Dr. Soto said my blood sugar test was 105. He told me 100 and below is normal, and that was when my cholesterol was really high and before I started to take Lipitor. He told me to really watch myself because I could get diabetes. He told me to cut back on sugar, so I did. But then I had another blood test a few weeks later, and my blood sugar was 95. So I've been real careful. I don't want to get diabetes.
Well, you've managed to control your weight, cholesterol, and prevented yourself from getting diabetes. You did all the right things.
And now my doctor tells me I have Parkinson's. Can you believe it? It doesn't make any sense.
Well, you are a model patient, and you listen to your doctor. And people with Parkinson's can live many productive years with the disease. Let me explain how the medication that Dr. Sanjay Sheth has prescribed works. The note in your chart indicates that he wants you to take Eldepril. Do you have the prescription with you?
Yeah, here it is.
This medication will help to improve the shakiness and tremors and muscle stiffness that you're having. It's a 5 milligram capsule that you will take twice a day. Take a capsule with breakfast and a capsule with lunch. You might notice a couple of side effects. For example, you might have dry mouth, feel a little dizzy, feel nauseous, and have a little trouble sleeping. If these continue, tell your doctor. I'll give you a list of all the possible side effects, some common and some that are rare. For example, bloody or tarry stools and vomiting that looks like coffee grounds. Do you have any questions?
No, not really. I just hope it works.
Like I said, you seem like a good patient. So if you follow your doctor's instructions, the medication should be able to decrease your tremors and stiffness. Now, you also need to pay careful attention to what you eat with this medication. Foods that should not be eaten while on this medication are cheeses, such as Parmesan and cheddar, certain meats like salami and liverwurst, and other foods like pickled herring, sauerkraut, soy sauce, and red wine. These foods and others need to be avoided to prevent a serious high blood pressure reaction. I'll give you a complete list. There are many, so read it carefully and share it with your wife.
Are you kidding me? I can't have my glass of red wine with my dinner? And no Parmesan cheese with my pasta? How can these foods cause high blood pressure?
Well, they contain tyramine, and tyramine in combination with your medication can cause serious high blood pressure.
I can't believe it. I have to change the way I eat?
Well, you did a nice job avoiding sugar to prevent diabetes, and you can still eat healthy food like fruits, vegetables, and whole grains. They will also help to prevent constipation, which you have a history of. One of the things Parkinson's can do is slow down the digestive tract. If you feel constipated, talk to your doctor and ask him if it's okay for you to take the Sanus up again.
Should I stop going for my walks?
No, walking is helpful. When you walk, just slow down a little. You can also swim. You'll need to make a few adjustments now that you have Parkinson's. The medication can help manage any problems you may have with walking and moving. And remember, people with Parkinson's can live good, productive lives. Talk to your doctor if you have any questions about the disease or if you notice any new changes or symptoms, such as difficulty swallowing, chewing, and speaking. And although there is no cure, Parkinson's is treatable. There are many support groups. Do you have the internet at home?
Yeah.
I'll give you the web address of the American Parkinson's Disease Association. You'll find a lot of good information and support on this website.
Okay. I'll check it out. Thanks.
Chapter 9, Post-Assessment. Dialogue number 2.
Good morning. I'm Eric Frank, and I'm the pharmacist who will go over your prescription and answer any questions that you might have. How are you today?
I've been better. I'm here to get my prescription to help me with my anxiety. My doctor told me I have an anxiety disorder. He said it's called GAD. It means Generalized Anxiety Disorder.
Okay. Can you tell me your name?
My name is Karen Manning.
Okay, Karen. I'm sorry to hear that you're experiencing anxiety. It's a good thing you went to see your doctor. There is a treatment available to help people cope with their GAD. What is your doctor prescribed?
I think it's Xanax. Here's the prescription.
Okay. Before I fill your prescription, I just need to ask you a few questions. Have you been to our pharmacy before?
No.
Karen, what is your date of birth?
December 31st, 1968. I'm 38.
The doctor prescribing the medication is Dr. Brian Duncan.
Yeah.
Karen, do you have any allergies?
No.
What's your home address?
37 Marina Drive in Edison.
And your home number?
766-1187.
Are you currently on any medication?
Just birth control pills and vitamins.
Do you have a history of any medical problems or conditions?
Well, I had my appendix removed when I was 10. I developed a pretty bad nail fungal infection that I got at a nail salon about 2 years ago. I took a medicine for the fungal infection, and I had some acid reflux a few years ago, but I'm fine now.
And you're not currently taking any medications for the fungal infection or the acid reflux now?
No.
Okay. Now I'm going to fill your prescription for Xanax. Did Dr. Duncan tell you how the Xanax works and how to take it?
He just told me take 1 pill a day and make an appointment to see him in 2 weeks.
Well, there are things you should know about Xanax. Xanax will help to treat your anxiety and will produce a calming effect. Different people will experience anxiety for different reasons. Some people experience GAD as a result of having a hard time coping with an illness and sometimes stress, such as stress with life situations, such as work, can trigger anxiety.
Yeah, with me it's my work and my boss. I've really been having a bad time at work, and I can't sleep. I feel restless. I can't concentrate. I get headaches and sometimes diarrhea. And I used to exercise regularly, but my anxiety is so bad I can't even do that.
The Xanax should help you to feel better. It's an anti-anxiety drug and a sedative, but you need to be careful with Xanax because it can be habit-forming and cause dependency.
Will it make me sleepy?
Well, it can cause drowsiness and dizziness, so be careful if you need to be alert to drive. And try not to drink alcohol when on this medication. And though unlikely, let your doctor know if you have slurred speech, trouble walking, or feel clumsy. I'll give you a complete list of all the side effects, so read them carefully. And if you're having any problems, let your doctor know immediately. And do not share this drug with anyone. It's against the law.
What if I'm still not feeling better? What if I'm still having anxiety attacks and feeling anxious?
Let your doctor know. He may need to adjust the dosage.
Okay.
Continue to see your doctor. Share your concerns and worries with him. Take care of yourself. Try to get enough rest. Eat well, try to exercise, and go for long walks. Avoid caffeine and nicotine. Both can make the anxiety worse. And do not drink alcohol. I hope you start to feel better soon.
Me too. Thanks.
AVN Pharma Education.